So, as you know, I'm Dr. Jeff, and the host today of this webinar. And what we have is we have Dr. Laurie McCauley, and Laurie is a veterinarian. And she graduated from 1992 from Colorado State University, and after 6 years in practice, she moved into veterinary rehabilitation, and she designed the first underwater treadmill for dogs, which has sort of become a mainstay at most rehab facilities in Vetland now. And she started her first rehab clinic in 1998, and it was called TOPS Veterinary Rehabilitation. And she's also on faculty at the Canine Rehabilitation Institute for 14 years. She's certified in acupuncture, chiropractic, and also board certified in canine sports medicine and rehabilitation. There's not many that we have out there that have done that, guys. So she was one of the pioneers here. And so anyway, she's got several awards. The one that I really look at is HVMA, the Holistic Veterinary Medical Association Practitioner of the Year Award, which is quite an achievement in my view. It means all the other veterinarians were looking up to her. So she's a frequent locum at Louisiana State University School of Veterinary Medicine, and she is now here to talk about fascia. And that wasn't a topic 2 years ago that I'd even heard of. So now she's going to tell us all about this thing, what it does, and what we can do. So there you are, Laurie.
I'm sorry. I thought you were going to be asking me questions about fascia.
I'm going
Um,
to start with you. Tell me what it is, and then I can
yeah,
ask you
okay.
questions.
Okay. So fascia, the easiest way to understand it, there's two types of fascia, soft fascia and dense fascia. So if you eat chicken and you've peeled the skin off, and you see that thick white line of stuff that you can peel off, that's your thick, dense fascia. It's like an exoskeleton. It's like a skeleton around that kind of holds everything together. It holds on to the tendons and ligaments and all of that. And then there's the soft fascia, which if you think of like a spider's web, and then you were to mist that spider's web with water, and it had the little droplets around and things kind of slide and move, that's the soft fascia. And that is literally around every cell in the body. So every muscle fiber, which is each a cell, every cell in your liver, under the skin, everything is connected with fascia. It even controls the motion, or it goes around the blood vessels, the lymphatic vessels, the nerves. So when there's a problem, it can cause problems everywhere. And it can be anything from little things like you don't move as well, right? You see people who are like, I can't lift my arm up. And then 5 minutes later, they can do this. That's a fascial restrictions. Or you can see people who are stuck like this or like this. Sometimes that's bone collapse. A lot of times that's fascia. It's just really, really cool stuff. And there's so much we can do to fix it. And the first step is being educated about it.
That is right. Because when I went through vet school, I call it in the dark ages, fascia was just this covering over the muscles that got in the way for doing surgery. That was it,
Yeah.
you know. And we really didn't know anything else about it, unfortunately. It was just a case of yeah, it's there, it gets in the way, it's fibrous tissue. There was no comprehension that it had an actual function, and now the function has gone out of this world. So, what role does it play? Apart from, I mean, we thought it just connected things together, formed a covering, and that was it. It was just as benign tissue. But what does it do now?
So we know like there's crazy research, right? I'm a research nerd, you know that. There's research in things like cancer. We know that fascia, when it's healthy, helps fluid move, right? It can help get rid of edema and things like that. When it's not moving, if you think about like getting stiff when you go to get up, or you're like, oh, I gotta take a couple steps, that can be your fascia being stiff. When it gets stiff, if you have cancer, it increases the chance of metastasis. because instead of that fluid being able to go into the lymphatics and the body fights it and gets rid of it, it stays in one place and can get stuck. You can't drink my drink, puppy. So it can have such an important role. It can think about a dog, right? If they're going to run, if they can run freely, if they can move freely, they can be faster. So with our athletes, working on the fascia allows them to be the most they can be. But even like in arthritis, the fascia can get inflamed. And again, we call it like gooey, sticky, and it in itself can cause restrictions in the ability to flex and extend joints. It causes fascia has 10 times more nerve endings in it than muscle does. And when it starts zinging, that's what causes trigger points. And a trigger point can be anything from a spasm in a small area of muscle to what we call a non-encapsulated, so there's no capsule around it, fluid-filled cyst. So like I've had them in my neck. If you've ever been like, oh my God, there's a tumor, and it feels like a gel cap, right? Or we go in and needle it, and all of a sudden it goes away. That was a trigger point, a severe trigger point.
Yeah, that's one thing I learned in acupuncture, and that is you find the trigger points, put the needle in, wiggle it a bit, and it relaxes the trigger point, and gets rid of the pain.
Mhm.
Yeah, that was the main thing. But I find it fascinating now because there's a link from fascia to meridians.
Yeah. So there's things like, I'm going to pull this out, and thanks for reminding me, Patty. Things like a tuning fork that you can use. And the reason I say Patty is because I have amethyst on the end. And we can do things like go over using specific frequencies, and there's different frequencies. You can stimulate an acupuncture point. You can use this to get rid of a trigger point. A lot of my clients are, let's say, menopausal or postmenopausal ladies that like wake up at 4 o'clock in the morning, right? And we can use a tuning fork to turn on our parasympathetic nervous system and bring that crazy, can't shut it down mind into relaxation. There's so many things we can do. Now, that's not specifically fascia. It's just one of the tools that we use to treat fascia can do so many things, which is really cool.
Neat. Okay. So if I've got a dog in front of me, when would I start thinking? Generally I'd be thinking sore knee, arthritis, or an owie, something, right?
Mhm.
When do I start thinking fascia?
So like I just said, I have a 17-and-a-half-week-old puppy. I'm not worried about fascia at all, right? But my heart dog, Sid, come here, buddy, right? Now, he's amazing. One of very few dogs in the world that can walk on a round ball, but he also turned 7 in June, right? So we can start to see things like, let me see. Yeah, he's pretty good, but something people can check on their dog. I know I'm going to turn this down a little bit so they can see you better. Things that they can check on their dog is you should be able to put your fingers, I got you, on the jog. And can you see how much I've attached my fingers to his skin, and I can move the body. I can move the skin separate from the body all over in the place. A lot of dogs, like if you think about that have hip issues, if you go to do that in their back end, you'd have very little motion. And that's sticky fascia, right?
Ah,
You might say, okay, trigger points. Dogs that have hip issues commonly have trigger points up in their sartorius, up in here, the muscles that, or the gluteal muscles that help stabilize the hip. And getting rid of that allows them to work better to help stabilize the hip. So if we think about, if we have a trigger point, the muscle can't contract all the way or stretch all the way because the trigger point is stopping that. So if we're not contracting and stretching, we actually have atrophy or weakness in the muscle instead of being able to strengthen the muscle to help stabilize the joint. So by getting rid of the trigger point, we can then do the exercises to stabilize the joint which then gets rid of the pain. And not only can we stabilize the muscle or strengthen the muscles around it, we can do things like strengthen tendons and ligaments, right? We can hypertrophy or make them thicker, stronger. So, but the first step of that is getting rid of the trigger points.
Huh. Yeah. One of the favorite trigger points that I've have found in dogs, and this is it was with the forelimb lameness, the front leg,
Mhm.
the triceps.
Huge. Yep,
Yeah.
absolutely.
They always seem to have trigger points in them, and the nice thing about those is I could teach people how to find them just by feeling them, and then
Mhm.
okay, put pressure on, and that seemed to help. Is that the right thing to do?
Well, you can. So
Okay.
that can be ischemic compression.
Yeah.
So let's go for a second. You talked about triceps. So if the dog's back is straight and their neck is straight and then their head goes straight down, I'm going to bring this down again so you can see better. Every dog, every breed should be able to take their front leg, can I have it please? And bring it up to the corner of their eye. If they can't, the number one place that we're going to see a problem is, like you just said, the triceps, this triangle muscle right here. And if you come underneath and support it, you would be able to feel it if there was a trigger point there.
Right.
And like you said, putting pressure on it, let's do a human thing. Oh, thank you. Because I want people to be able to feel this. So for everybody that's here, I want you to take your hand and come up to your trapezius, right? So if you come and see here, there's a really good chance you have a trigger point there. Do you feel something kind of a hard little bump, right? You put pressure on it and you're like, I feel that. Okay, everybody put pressure on it. Take a big breath in. Deep breath out. As you breathe out, I want you to put more pressure on it. You're feeling it relax. We're going to do it again. Ready? Deep breath in. And then as you breathe out, put more pressure on it. There you go. Now feel it. It should either be gone or at least much better. That's ischemic compression. What we're doing is we're pushing the blood out. Puppy, that's enough. Thank you. We're pushing the blood out. And then when the blood rushes back in, we release something called Golgi tendon organs. You don't have to know that. It's just a mechanoreceptor that says, let's go, get rid of that spasm, get rid of that problem. And the trigger point goes away.
I haven't heard the Golgi thing for 40 years, Laurie.
And the Golgi tendon organ. Yep.
Yeah.
Yep.
Wow.
Again, research nerd, I admit it.
Okay. Okay. So if I identify those, that can help. And that's what I did with people. I didn't get them to do the breathing thing in their dog, but I did get them to put the pressure on, and they worked them out. Right.
Yeah, can I play with you, Jeff?
Oh, sounds like fun.
Okay, so what I want you to do is stand up and take a couple steps back. This is going to explain to you the breathing thing.
Oh, okay. So while I'm doing this on my dog, I'm breathing. Is that what you're talking about?
Yep, you're going to take a step back. Nope, 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 nope. I need to flip it the other way. There you go. Take a step back. Now turn to the side. Yep, yep. Now I want you to go and reach and touch your toes or as far as you can go. Okay, now stay there. I want you to do a big, deep inhale. And you guys at home, I want you to watch him, but you can practice this later. Big inhale. And then exhale. And go further. See if you can reach further. Yep. Usually you can reach like another inch or two. All right, you can stand back up. So you exhaling relaxed your fascia and allowed you to stretch further. What's super duper duper cool is that we can take dogs and like I just stretched Sid's leg forward, is if he's like, I can't, my fascia's tight, I can do the exhale and stretch his fascia better. So you controlling your breathing can help relax your dog. Isn't that cool?
Okay. So are we talking about entrainment from the dog to us?
You know what? I have talked to neurologists. Nobody can tell me why, yet it's reproducible in every single dog. Yep.
Oh, okay.
You want one more tip? on how to release
You
a
ready?
tight muscle?
Y-
Sid, Sid, come. Um, in humans, so for everyone listening, if you can play at home, you can put your arm out and have somebody push down and say resist, right? And you're gonna resist it. And then the second time you do it, you're gonna say resist, but then you're gonna jiggle it. It's a form of vibration, right? And
Mhm.
it's gonna drop. So Sid, come here. How do we use that in the dogs? Hup. Thank you. So let's bring this down again. Say I wanted to bring his leg forward and his triceps, whether it be a trigger point, the whole muscle's tight, the fascial line is tight, and he's saying, I don't want to do that, mom. I can say, come forward, and then I can jiggle it. And as I jiggle it, he's going to let me take it forward. So by using a form of vibration, right? You could call that acoustic therapy, right? We're decreasing the stickiness in the fascia and allowing it to stretch better.
Okay. There's a term I've heard, and it's called time and tension. That's for building muscle. Is that the type of thing you're doing here? You're sort of keeping the pressure and keeping the tension on as you're going?
Well, it's not just the pressure, right? Because I could keep it there for a long time and it's not going to, may or may not change,
Okay.
right? So stretching certainly can stretch the fascia, right? So think about doing yoga, right? Yoga, if when we look at the different positions, are all ways to stretch the fascial lines, right? We've seen, you can map out the fascial lines in people and you go, oh, if you're doing this pose, you're stretching this line. And if you're doing that pose, you're stretching this line,
Right.
which is super cool. But the vibration is actually separate. It's a massage form that literally the vibration affects how that soft fascia aligns and allows it to stretch.
Okay. And so related, if you found that trigger point and you're stretching it and you put I call it a vibrator on. There's tools that vibrate the muscles.
Yeah,
Would that work?
it can. Yeah.
Okay.
Yep. And I think
Oh,
that's related to the tuning fork, right?
uh-huh.
So,
Okay.
I mean, I've certainly used a vibratory tool on my neck. I've certainly used the tuning fork on my neck and releases the either fascial lines or the trigger points. There's all different ways, which is what's beautiful, right? And if one way doesn't work, you just try another.
Perfect. Okay. Yeah. So your technique is working. Because I don't know if you saw this, but Dana tried the jiggle technique on her dog and it worked.
Woohoo.
Okay. What about cats?
Oh, well, cats are Gumby anyway. I don't know, like my cats, I can take them. When I learned chiropractic, we're like, oh, the dog can turn their head this far. Hold on. You guys, shh, sorry. You could take their head this far and then you take the cat and they're like, oh, you're an owl. You can almost look behind you. So they can have fascial restrictions, but not nearly as much as dogs.
Ah,
They're more lumpy. Now, if they get dehydrated, well, humans, dogs, or cats, if they're dehydrated, can again make the fascia sticky and harder to stretch.
okay. Okay. Another question. And so Dane's asking, can you point out trigger points for the front and back legs on the dog again? I don't know if you're, so you just got to tell people how to find those guys.
Yeah. So Sid, come to me. Good job. Come. So, I mean, we have a whole fascia course on this coming up with pet parents. And we've got the webinar, Fascia Fun Vital Points for Mobility, that we're going to talk about this. But get down. Thank
I
you.
just
We
put
have
the link to the course in the chat,
some,
Laurie, so people can
well,
look at it
that's
if they
linked to
want
the
to.
webinar. That's a free webinar.
Oh, that's the webinar. Sorry. Yes.
But yes, please come. New puppy doesn't have manners yet. Things to know. You can, we showed taking. No. hold on. Lie down. Thank you. Let's practice down, stay. Sit. Up. Every dog, every showed going forward. Every dog take their, oh, let me move this. Take their front toes and taking their front leg like a clock arm. If come back and point to or touch their knee. Every dog, every breed should be able to take their back and point to keeping their back straight. Super important. We're not just flexing the back. Point to or touch their elbow. I don't know if you can see that.
Yeah,
He's
we can see that.
and then you want to be able to have full extension. So you want to stabilize. I'm on his pelvis here. Stay. And you want to be able to extend the hip all the way. Another way to do that would be to have the dog stand up. And if we do this, they should be able to extend their hips evenly. So if one of the legs has to step in front of the other, that means they can't extend their hip all the way. And again, it can be a joint problem, tendon, ligament, fascia, muscle. But that's an easy way to go through and check at least some of the places for trigger points. So common places, easy way to remember it, the back of the front leg and the front of the back leg. That's your most common place that you're going to have trigger points, but they can be pretty much anywhere. Here's the puppy, 17 weeks old and getting bigger.
Yeah, he's huge.
Yes. Yeah, mom was only 40 pounds. I think she's going to be a lot bigger. You can't eat my necklace.
Oh boy,
Fun.
troublemaker there.
Yes.
Okay. So we've got all this fascia. So, and just give you an idea, like in the webinar that's coming up that I put the sign up in. Where are you going to be taking them in that webinar? Where are they going to be learning?
Well, we're teaching them a lot about fascia. It's myself. No, she is never this loud. Stop. I am so sorry. Here, have a toy. We're going to be talking more about fascia, showing where it is. Lots of, some ways to fix it, more ways to find it, because there's so much to learn.
Yeah. No, there's certainly the thing that I found this a couple of weeks ago is that the fascia is working. It has a lot of nerve endings, as you say. It follows the meridians in the Chinese perspective, which explains how acupuncture needles put in that spot can affect something down the road.
Right. So the fascia is all connected. It's all one big sheet. And when you put an acupuncture needle in, not only are you affecting the cells underneath it, but we twist it either clockwise or counterclockwise, depending upon what effects we want in the body. And that's literally wrapping that fascia around the needle. There's research behind that shows that when you're spinning it, you're wrapping the fascia around, which is having an effect all around the body, which is super cool.
Wow. Okay. So this fascia, like you say, it's around every cell. Okay. So obviously we can't see it.
We can. So again, remember, think about the chicken, right? We have this. So if you pull the skin off, the soft fascia is what's connecting the skin to the muscle. And then the firm, the dense fascia is what's over the muscle. And there's actually lines. Thomas Meyer has books on it, on the human, and you can actually see where they've done the dissection. Fascia is around the brain, it's around the lungs, it's around the organs. It's, and they've done the dissection where they take all the other cells out, and then you can see those firm lines of fascia that just, you can see how they're connected and why you hurt your ankle, right? And all of a sudden your head's tilted because that line that goes up your leg, up your side, up to your
Mhm.
head is actually pulling and affecting your posture. You know,
Right.
and
Okay. So,
and we can affect that whole line.
yeah. So that has a tie-in with cranial sacral therapy.
Yes. Yeah, the craniosacral rhythm. As the brain pumps cerebral spinal fluid, just like
Mhm.
the heart pumps, we have the ventricles in the brain. The fluid comes down from the brain and it bathes the spinal cord in what we call the dura mater, which is, if you've ever seen up a dog's nose, they have the what we call nasal turbinates, right? It's why they can smell so much. There's so much surface area, right? There, it's crazy little lines. The dura also has that, and the fluid has to go through there. So if with craniosacral, we're clearing, we're getting that fluid balance to come through, and anywhere where there's compressions in the dura, which is fascia, and not allowing that fluid to flow, we can have an effect on that. So we get little gushes of fluid so that it will clear that line so that the fluid can flow and the whole nervous system can work better.
Amazing.
It's cool
Yeah.
stuff. Love
Yeah.
cranial.
Yeah. Once you put fascia in the mix, it really does explain cranial sacral therapy because I was trying to figure out what are they doing back there? Like because they're just holding, waiting, waiting for that rhythm, right? Yeah. Well, that's
Yep.
great. Okay.
Actually, when I do cranial sacral, I learned it. And how do I say this politically correctly? I'm like, I don't have the time or the patience to sit and wait for it to balance in my hands. So I learned how to help it balance much faster so
Oh,
that we hands on and get the fascia moving, get the energy moving, get the fluid moving, so that and then all of a sudden everything moves well, and you're like, wow, the dog's doing great.
okay. So is that releasing the fascia then?
It can be. There's a lot of things it can be doing. And to be honest, I don't know that we have enough research to know everything that it does. So we can look and say it does this, but that doesn't mean it's not doing five other things as well.
Okay. Okay. So let's put it together this way. I've got a sore dog, and my conventional veterinarian says Medicam, Rimadyl, joint support, and and walk. Keep the muscle going. How does this change that therapy? What are we going to be doing?
Well, I will never go against a veterinarian, right? That would just be silly, right? They have put their hands on their dog on the dog.
Hmm.
My goal, my mission in life is empowering people, optimizing pets, right? So educating people both on the professional side and the pet parent side so that they can help. So I would say you can use the fascial therapy to relieve the restrictions, use the exercises to build the strength to support the joints, and then peel back the NSAIDs or the drugs that may cause your kidney problems, your liver problems, your any of your side effects, your vomiting, any of that,
Yeah.
so that the dog can have the optimal quality of life with the least amount of drugs necessary. Now, I do not put supplements into that. I think supplements are wonderful. I mean, there's tons of research on like omega-3s and pernamuscles and turmeric and all kinds of great things that help with controlling the inflammation. Because remember, it's the inflammation that's making the fascia sticky to begin with. It's the disuse and inflammation that causes many of the fascial issues, right? Trauma, there's other things, but then trauma leads to
Okay.
inflammation. So
Yeah.
we want to do everything we can to get rid of the inflammation with the least amount of drugs possible.
Right. Yeah. I gave a webinar this morning on ununited anchineal process,
Mhm.
right? And looking at, it's more or less surgery or not, or that type of thing. So you can sort of see where fascia would come in as a side problem to
Oh,
that,
yeah.
you know.
The scar tissue just globs on,
Yeah.
right? You have that ununited anchineal process, And you've got that crepitus, you've got that. So crepitus is the grinding. You have the soft tissue crepitus. So the popping are these little fibrils of scar tissue, right? And my goal is always when I feel that is to break them up because they're just making things more sticky and then strengthening, right? You don't want to create laxity. You want to then strengthen the support structures because scar tissue is like Elmer's glue, right? It can hold things together, but it breaks apart really easy. So we want to
Oh,
get rid of
okay.
that and strengthen the tendons and ligaments and muscles that are supposed to support things, which are much firmer.
Right. Yeah. Dee put a reference in the chat, the reference book, The Endless Web.
Yep. Yep. Excellent.
Yeah. Yeah. That one, I've read parts of it. I haven't done the whole thing by any means, but yeah, it really does push into what we're talking about today for sure. Okay. Okay. So if I'm looking to do things on fascia, do I need to find a practitioner who's aware of this and doing it, or do I talk to you?
Yes. So there's different levels, right? It's the difference between do I go to the gym and work out or do I work with a personal trainer, right? Or do I work with an Olympic trainer, right? So there's different levels of education and you're going to see different results. Can you do things at home that will help your dog? Absolutely. That's like saying every morning I'm going to get up and do sit-ups and push-ups and go for a run, right? As compared to, can you find a professional who's trained in this? That's like, I'm going to the personal trainer and, they're going to give me specific exercises for exactly what my body needs and where I need to get stronger. And then if you're like, you know what, my dog has a really serious problem. I need the absolute best. Then you find somebody who is like specializing in this, right? And then they can say, okay, this is what we need to do for your dog. And we're going to do this and we're going to teach you things and you're going to do this at home and you can work through it with that.
Yeah.
And that's what I teach, right? We have the Fascia 101 course for professionals that we've had 300 people, 300 professionals take the course. Patrice Corticus has a whole certification up in Oregon. I've been through her courses. She's wonderful for professionals. And then the more we can teach pet parents to do for their dogs, the better, right? I always tell people if I work on 10 dogs, that's great in one day. But if I can teach 10 people, for every 10 people I teach to do what I do, that's 100 dogs a day, right? So the more I can teach, the more people can work on their dogs or work on their patients and help everybody.
Yeah. No, it's a great mission. And the thing about this is I see it as it's wonderful we can do this stuff.
Mhm.
But most veterinarians have never heard of it. And so because of that, you're going to take Fluffy to see the veterinarian. Let's assume Fluffy's a dog because cats don't have this problem. Uh,
Uh-huh.
but you take Fluffy in and then they go through the regular conventional options, but this doesn't even come up.
Education,
Yeah,
education,
yeah.
right? It's the same thing with, educating people on the importance of exercise, right? It's the number one thing to increase longevity,
Yeah,
exercise,
that's right.
right?
Yeah, yeah, we do on it. Yeah, and those are simple things that we know as the norm, but
Mhm.
interestingly, your medical doctor isn't going to tell you to do it.
Education, education,
Yeah, they're
education.
busy doing other things, right?
Well,
Unfortunately.
if people are interested in that, I mean, I listen to Peter Attia, The Drive, which is a podcast. That, again, I absolutely adore. He's so educational, and his thing is you need three kinds of exercise. You need endurance exercise. So that's walking, running, swimming. You need your strengthening exercise, and then you need your proprioception exercise. So for longevity, right? It
Yeah.
helps with knees, it helps with all kinds of things. I know we're off fascia. I love talking about, longevity and geriatrics and stuff like that, because there's so much we can do.
Yeah. But taking care of the fascia means you're not restricted. You can extend your arm
Yeah.
rather than just going that, right?
How many people can't do this, right? Right? Or come across and do this, right? Yoga, right, is stretching the fascia.
Yeah.
We can do body yoga.
Yeah. I had shoulder surgery. I couldn't lift it past where am I going? I couldn't lift it past that for 6
Mhm.
months,
Yeah,
right? And yeah, and so it took a long time to
that's
do that.
fascia,
Yeah,
right?
it was all
It's the
fascia.
only thing, it's either the muscle that's not able to do this, or the fascia that's restricting your ability to do this. It's that
Right.
simple.
Okay. Okay. So we've got a good idea on what fascia is, and then the main treatment for it is getting it
Wow.
getting it moving.
Getting it moving, right, that's the goal of the treatment, and there's
Yeah.
lots of different ways to do it.
Yeah. Oh, there's a question. How do I know how much time to spend working on the fascia on my dog daily?
That's fine, but I want to do it long enough to help him. Perfect. That's a great question. So when we think about like massage, one of the things we think about is like, as a human, if you've ever gone and you gotten an hour massage, it feels great. But if you were to go get like a 2-hour massage and they're doing deep tissue work, the next day you're going to be really sore. So for dogs, kind of depends upon their size. In general, your medium to large dog, we talk about, come here, Sid, spending 5 minutes on back and neck, 5 minutes on each leg, and then 1 to 2 minutes on each side.
Hmm.
Right. So that gives you about a half-hour massage. Now, if you have a Chihuahua, you need probably maybe like a 15-minute massage, right? Because their body size is so much smaller. And if you have a Mastiff, it may be a 45-minute massage. And you never want to spend more than, again, depending upon the size of the dog, 2 to 5 minutes in one place, right? If you take the attitude of, I'm going to get this trigger point out, you're probably going to create some soreness.
Yeah. I've certainly had that done to me, so I know that.
Mhm.
There's another question. If you have limited time, which parts of the fascia should you focus on?
The best thing to do is do the stretching exam to find out where the issues are. Oh, and then focus on wherever the restrictions are. So
Right.
if you have a problem stretching a back leg forward, you're going to say, okay, well, we're going to be looking for trigger points on the back of the back leg, and then fix whatever you find.
Okay.
Oh, this is great. Dana says he's a 5-pound Chihuahua with cerebellar hypoplasia. Oh, how sweet. First of all, Dana, thank you for taking care of that little baby. That can be a challenge. And neuroplasticity is a wonderful thing. Keeping that baby in an environment where they're constantly stimulated can help their brain compensate for the fluid in there. And literally, you're going to be spending, if you find a trigger point on a 6-pound Chihuahua, 30 to 60 seconds on a point, maybe a hair more, but that's it. Especially with this little guy who's like, I don't know where I'm going. You don't want him to get sore.
Yeah. Yeah. That would be a challenge for sure,
Yeah.
you know, and but that, yeah, that we have some definite, and here's a sort of related. If I have an amputee dog, a tripod,
Mhm.
I'm
Yeah.
assuming the fascia is going to be kind of messed up on that kid.
Yeah. 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 So again, sit. Hup. Thank you. Let's talk front leg or back leg tripod.
Oh, we'll make it easy. Back leg.
Back leg. Okay. So if I have a back leg tripod, we take this leg away. The other leg, the one that's supporting all the weight, is going to have, hello, little one, come on up. is gonna have trigger points on the inside of the leg, because the leg is gonna be held more toward midline, and that's gonna be overused, right? So we can frequently get trigger points or tight muscles from either overuse or abnormal use. The other thing that's gonna happen is that dog is gonna be shifting their weight forward, and we're gonna have a lot of trigger points in the front legs. And because they're shifting their weight forward, they're gonna have issues with the muscles right behind the front leg, because they're going to be keeping that in stretch. Does that make sense?
Mm-hmm. Yeah.
So, and again, you're going to be feeling him and saying, hey, where is he tight? Where can he not stretch? Doing different exams, checking the different lines and saying, okay, how do I fix this? And then you can have all different, ways to fix it.
Okay. Yeah. So definitely when you've got invalids, they're more prone to problems. So we've got to be able to address them.
Oh, yeah. And actually, let's talk about that for one more second. If you have a tripod as a front leg, one of the most common places to see issues is the neck, right? Because every step they take, they are throwing their head up to bring that front leg forward. So the lower cervical, the lower neck region, they're overusing that so that they can bring that leg forward. So they definitely are going to have problems, issues in the triceps and the biceps of the front leg, right? Triceps because they're overusing, biceps because they're leaning. But the neck is a huge one for that.
Mm, okay. Yeah. So, and that would be the top of the neck, I presume.
Actually, it's you may have some from here, but a lot of times it's lower cervical,
Oh,
because where the
okay.
big function is when they're doing that. They
Oh,
don't want to necessarily come from here and then do this. They want to just bring the head up so that the chest comes up off the ground and they can take that front leg and place it forward.
ah, okay. Okay. So question on the straightness of the back when you're doing the test on the legs.
Yes. Oh, he has never had a flat back since I adopted him at age 6. He's 10 now. Be harmful for him if he doesn't have a straight back, or do I need to do something different to help his back first? Great questions. Oh, awesome, Dana. So, Sid, come here. The reason we talk about having a straight back, I know you're not a demo dog yet. Come here. Hup. Thank you, buddy. Is because I can bring his toes to his elbow just by bending his back and not stretching his back leg at all. Can you see how everything's bent, but I bring it here because I'm curving his back. So if we have his back straight, the only way I can bring his toes to his elbow is by keeping his leg straight. There we go. And we're at the height there. And we're stretching everything along the back of the leg, his gluteal muscles, all the way up here. But if your puppy already has a curved back, you're going to have to do the best you can with what you have, right? You're not going to have to fix his back. You just want to keep his back leg straight. Think of it, instead of just bringing the toes to the elbow, keeping his leg or her leg like a clock arm, keeping it straight and then bringing it forward like that. And if you can, taking your little baby and putting them on a super, super soft surface like your bed or your couch, not on the floor, and having them just lay. You're going to let me do this. Oh, I know. It's not a super soft surface. It's just me. Upside down. I love you. And rub their belly. And you're going to say, well, why would you do that? Because their back is like this and it's curved and the muscles underneath are tight. Thank you. And then the muscles on top of his back are weak. And by having them on their back on a soft surface, you can rub their belly, and gravity is going to help stretch the muscles that are on the inside of his spine and take the stress off of the back muscles. And then you can massage those muscles, and then you can work on having him put front feet up on a raised surface and extend their back so that you can start to strengthen those muscles, and that will help take the pain away from their back. I hope that makes sense.
It did to me. So thank you. Thank you for explaining that. That worked good.
Yes.
Okay. Just going
And
to
then,
have a hit a few more things. This is being recorded, everybody. And Laurie is going to be giving you the link for that so you can watch it. So no problem there. I like this one. Competitive working dogs.
oh, I love it.
I
Hurting the
figured you would.
Yes, absolutely. Think about stretching your dog, doing cookie stretches with your competitive dog, getting their back moving, getting everything moving. Um, they are the herding dogs are likely to have bicep issues. So, because they plant and twist, right? When they're going around, right, and going up and up and down, they're really working their biceps. Um, through demonstrating. Thank you, Dana. Glad I can help your puppy. All right. So I know squirrel. So with the biceps, we take, okay, puppy. What you're going to check, Jamie, is that your dog that you can, Gumby here, take the front toes and with the back and neck straight, be able to bring it to, oh, you're big, all the way to the knee. Right? If you can't, there's two things. All right, you get down. Sid, you're my amazing demo dog. Come, Sid, hop, hop. Thank you. Two things have to happen, Jamie. We have to have the scapula or shoulder blade that sits here, and that has to be able to rock back. So as you bring that leg back, let me bring it down so you can see it a little bit better. As you bring that leg back, you should see that shoulder blade, and there's a spine, a bump that runs the length of it. That whole thing should rotate this way. If it can't, it tells us our trigger points or muscle issues are either the trapezius or the rhomboids. You don't need to know the names. You just need to know the muscles that attach the shoulder blade to the body. So somewhere around that shoulder blade are stuck. If you can bring the shoulder blade back, but you can't extend the elbow, right? If that stays bent, then you know that it's a bicep issue, which is on the inside, right? Every dog, every breed should be able to bring their front toes to their knee. If they can't, it's an issue in one of those things, in one of those places. Again, we're stretching muscle and fascia. And it's so super common in my athletes to have issues in the biceps. I mean, we have triceps, but biceps is even bigger, especially for the ones that plant and twist, that may run.
Okay. Yeah, I mean they put a lot more weight on the legs and a lot more trauma,
Mhm.
and the dogs themselves aren't that heavy, thankfully. But yeah, but they're geared for doing that, and they get hurt. Yeah,
Um,
sure.
the other thing for my competitive dogs is the gracilis. And that's super, super common. Biceps and gracilis are probably the two most common issues I see. And that's when you take that back leg. So instead of our Dana's Chihuahua, if we take the back leg and bring it forward, the muscles in the back here should all have the same amount of tension, right? So these are the hamstrings, they come across. So if you go to bring this forward and one of those is super tight and the others are soft, there's an issue. And it's the one that's tight is the one you're going to fix.
Yeah.
If they all have the same tension and you can't bring it up, then we know it's either gluteals or the muscles that attach the body to the pelvis because the whole system has to rock to be able to get under there. But again, it's the athletes that are propulsing themselves that can have issues with their hamstrings. It's very, very common.
Yeah.
Oh, you're welcome.
Okay, that's great. Okay, I thought would if you've got it, do you want anything more you want to talk, or do you want to go open up for questions?
Oh, I love answering questions.
Okay, so if anyone has a question, and we'll pull you up this time, put your hand up. This is the Zoom hand. Okay, and so if you want to do that, and we'll pull you up and we'll get your questions answered.
And then while they're doing that, we'll just remind you guys that in the chat, we have information to register for Fascia Fun, Vital Points for Mobility. that Dr. Jan Huntingford and I are doing on August 28th at 8 p.m. Eastern Standard Time. So come join us for that. It'll be a lot of fun, a lot of great information.
Okay. Link is there. I just put it there so people can definitely get involved in that as well. Okay. Great.
Questions?
So look at all the questions we don't have. I think everyone's shy. Or maybe it's something like this, and that is, does anyone know how to put their hand up? Very important little toy to be able to do. Okay. And I'm just going to my, it's hidden. Okay, maybe that's the problem. Yeah.
Oh, okay.
Oh, there
Are
we
you guys
go.
chat?
JS has got it going. There we are. Okay. So I'm gonna just ask JS to unmute. Come on in.
Hi, how are you?
Good. How's it going, JS?
Good, yeah. Thank you for this webinar. I'm really happy about it. I just wanted to ask you, especially in older dogs, I have a 8-year-old long coat German Shepherd, champion dog. Um, Eventually, like entering the car is quite difficult, and she does have some lumps and bumps on her mammary gland, so maybe that could be a thing, but they're quite small. And walking takes longer than before. Yeah.
I had a hard time hearing. Were you able to, can you restate that for me, Jeff?
No, unfortunately, JS, you seem to be a little bit incoherent and mumbled a little bit, and it was very quiet. Can you get closer to the microphone and then say it again, please? Are you there, JS? Oh, just one sec. He muted himself, so I just
No.
there we go.
Or
There we go. Back on.
I heard that you have a German Shepherd and the walks were getting slower. Um, can you restate the question? Oh, I think you might be muted.
yeah.
Oh, there you are. Okay, go ahead. I think there's problems with the microphone, maybe.
I think we're having unstable connection because we're not hearing the audio really at all.
All right, so JS, type your question in the chat, and I'll be happy to answer it. Other than that, anybody else have any questions?
Okay.
I hope you guys had fun.
Well, the main thing is this is a brand new type of treatment. Okay. And if you go to your, like I call a regular veterinarian and ask them, they probably haven't even heard of this. I'm sure you know that. Yeah.
I lectured at AVMA, which is one of the biggest conferences in the US on it, and at VMX in January, there's usually like 16,000 vets there. So I'm doing everything I can to teach everybody as much as I can so that they can help the dogs everywhere.
Ah, okay. Okay. I see your note there, JS. Thank you. And anyway, James, I don't know if it's the same thing. Jamie Swanson, I've just asked you to unmute. I'll do it again.
Hi, sorry about that. Can you?
There we go. Okay.
So I have a German Shepherd that is slowing down walking and even running and other activities, and even especially getting into the car is
Mhm.
very difficult. She is on some joint supplements, some you move supplements, but I don't know if they're really working.
The first
What
thing
is the
is have your vet look, right? And find out, is it arthritis? Is there inflammation? Is there pain? German Shepherds in general have, let me ask you this, JS, is it a German bred or like Yugoslavian bred dog, or is it an American German Shepherd? Do you know?
Oh, just one sec. Yeah,
it's a
and
German.
don't close your microphone down, JS, or else I'm going to keep missing you here.
Sorry about that.
That's fine.
It's a German Shepherd. It's a German Shepherd, but not really sure what. It looks
Okay.
like a European one.
Okay, so your German Shepherds are moderately angled. The American bred ones, because they've been bred for like ring sport and Schutzen, are much more angled, and they're going to be more likely to have issues with the hips and lower back. So, again, every dog is different. I haven't seen your dog. I'm not making recommendations. I'm saying that in general, German Shepherds can have issues with their wrists. So we think about the muscles here. They can have issues with their hips. So the gluteal muscles, the butt muscles, and the hamstrings, and then their lower back. So if I had to guess why she was sore in general, I would say those are the most important places to look.
Okay. Have you had any exam done at all, JS?
So it has some mammary gland tumors, but they're not quite massive, and skin problem, pyoderma as well. So that could be the one another linking thing, because it's declining your health as well. So that could be related to all these joint things, and even inability to even grab a football like before. Like before, she could actually hold a football, but now she can't even grab onto a football.
So if she has mammary gland tumors and they are small, it may not be as big of a deal, but as they start to grow, that causes contraction on the lines on the underside of her belly. So stretching is going to be harder for her. It may even be painful for her. So like we talked about the little Chihuahua baby that we had lay upside down. If you were to lay your German Shepherd upside down and say, can I stretch the back legs back and the front legs forward? And she's like, ah, that's harsh. That's too much. Don't do that. It may be that that line is sore, and we have to be super careful because we don't want to do anything that's going to hurt or increase the blood flow to tumors, right? Your vet may recommend removing the tumors. Certainly after they're removed, then stretching that area would be good. I would be hesitant to do too much with her belly until your vet has decided what the best course of action is.
So my vet has told me not to operate. One vet is saying to operate, and the other vet is saying to not operate because of the 8 years she is.
So that's when you gather all the information you can and make your best educated decision.
Yeah. Is
Every
she
one of us is
is she
anything.
intact, JS?
She is intact, yeah.
She's intact, yeah. And that also plays a role with mammary tumors. And that is they tend to grow more if they're still having their heat cycles, right? And so that usually is part of the package of doing mammary gland surgery and sterilization at the same time for that reasoning. Okay. So
And I
that's why you
think
need to talk to the doctor. Okay.
stretching is quite difficult recently for the dog, yeah. As you said, yeah, it's difficult for her to stretch, yeah.
Yeah.
Thank you.
You're welcome.
Okay. Okay. Jamie, I'm gonna unmute you.
Can you hear me?
I wrote clear, beautiful.
Great. So yeah, I did have the question about the competitive herding dogs. I have a 4-year-old intact female that I am competitive with, and she's fairly active on a daily basis, but we now have a suspected CCL tear. So with that, I'm going for a second opinion tomorrow, but with that and knowing having that information, would you change anything or would you continue to do those the same stretching technique in the rear.
Great question. I have to ask, what breed?
Border Collie.
Okay, okay. Border Collies stretch, flex, bend more than any other breed I know, right? So it would, my answer might be a little bit different if you had said she was a herding Aussie that was thick and broad. Or actually, let me ask you this. Is she a thin, narrow, like agility bred Border Collie, or the wider, true herding?
She's a combination of show and working,
Okay.
but I know her angulation is not like her stifles aren't as well turned as they should be, but I wouldn't consider her completely straight either.
Okay,
So
good.
this was a complete shock to me.
So actually, I think, Jeff, didn't we do a CCL webinar?
We did on how to prevent a problem, and then how to detect it and how to prevent a problem. Yes, we did that. Yeah. Yeah.
So for Jamie, I will answer your question, but Jeff, is she able to go back and see that? Is that somewhere that she could find?
I have been watching a lot of those videos.
Okay. Okay. So
Okay.
Jamie, my information for you is 30 years ago when I got out of vet school, a CCL tear was the dog jumps up to catch a frisbee, they come down, they land wrong, they twist, and it was a pop. Nowadays, it's inflammation, and inflammation in the joint. You start to have, you get more and more inflammation. You start to get a little effusion, right? I teach my clients how to feel that, which is swelling or fluid in the knee. And then you get pop, 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 because your cruciate is a ligament, which is like thousands or millions of fibers. And you can pop each individual little fiber until you have a partial tear, which is more than 5% of the fibers torn, less than 95% of the fibers torn, or a full tear, everything's torn. And if you've got inflammation in one knee, you are probably starting to get inflammation in the other, especially if there wasn't a traumatic injury. So are you going to do flexion and extension and massage and all of that stuff? Absolutely. Is she going to say, hey, if I have a cruciate injury on this side, I'm going to be overusing the other side? Yes. Is she more likely to have trigger points in the sartorius and the tensor fascia lata, which is right where the body and the leg come together on the leg, right in there? Yes. So you're going to look for that. The gracilis muscle in any of my working dogs, that's the back and the hamstrings. You're going to look for issues there. You want to keep her as loosey-goosey as you can. And again, she says, hey, my leg hurts. I'm going to shift my weight to my diagonal leg. So you're going to be looking spine, and you're going to be looking at the diagonal limb for trigger points. Does that help?
Yeah, it does.
Yeah.
And then strengthen. We know that the sartorius and quadriceps, which is above the knee on the front of the leg, and the gastroc, the calf muscle on the back of the leg, those are the muscles specifically that help stabilize the knee, that help the ligaments on the side and the cruciate ligaments in the middle of the joint. So we want to strengthen those to help stabilize that joint. And then you decide, if their fibers are torn, do we try to heal it, or do we just go ahead and do surgery? Right. And that is, I actually have, I'm learning all kinds of, there's over 500 research articles on cruciate injuries and surgeries and all of that stuff. And we're putting together information on that. So that will be this fall coming out. It's not going to help you this week, but yeah, there's so much information and there's so many things we can do. And please, please, please work on the other leg for whatever you're going to do for the leg that has the injury to decrease inflammation, whether it be laser, PEMF, your omega-3s, all of that stuff. You're making sure that you're doing everything for both sides, because if one side tears and there's a 50 to 60% chance of tearing the other side if within the next 2 years. We don't want that to happen.
Mm-hmm.
And we don't want arthritis in the first side. So there's so many things we can do.
Okay.
It's really fast.
Yeah. There's a paper that I've quoted a lot in my webinars, Laurie, and it was done on they called them large dogs over 50 pounds, full cruciate tear, and they broke them into two groups. One group surgery, and they didn't define the surgery; they just said surgery. And the other group, half of them, was they called it medical treatment, which meant, and this was really limited, anti-inflammatory medication and weight control. That was all they did. But, and this is the numbers for you, so this will help you, Jamie. The ones that had surgery, 75% of them had adequate function rated by the owners. Okay, so still 25% that limped and had problems and whatever in that leg. In the ones that did not have surgery and just had the quote medical treatment, 69% had adequate function. So the point being is surgery didn't give you a whole lot more. It only gave you about 6% more in terms of adequacy. So I look at that and go, wow, but also we can improve on the medical treatment so much more by adding laser, nutraceuticals, chiropractic, CZ loops, you know, whatever, right? You can really get into that.
Yeah,
Okay.
we're doing PEMF right now, PEMF massage. She's on fish oil and just ordered a new supplement for glucosamine with green lipid muscle. And then we're going to rehab specialist tomorrow for
Perfect.
second opinion.
Excellent.
Looks like you got it under control. That is so nice to hear. Okay.
Thank you.
You know, Jamie, does she have a medial buttress? Because that will also give you an idea of chronicity, how long it's been going on. That's a thickening on the inside of the knee.
I'm not sure. To me, it feels a little thick, but
Okay.
I'm not 100% confident that I know what I'm feeling at the moment. So we know the massage therapist and my regular vet have felt crepitus, but it was kind of like, well, maybe it is, maybe it isn't. And we didn't do x-rays, which I wish I would have just to get a baseline.
Yep.
But that's what we're just trying to, I'm trying to get an idea of how long it's been going on and what the severity is of it.
How old is she, Jamie?
She's 4.
4. Okay. Yeah. Yeah. So anyway, you're going the right path and you're getting lots of probably, I think, lots of guidance and answers, which is really nice to hear.
Well, thank you. And thank you for doing these videos and these webinars. It's really nice.
I'm not, I guess I am. I'm going for a free plug here. Laser decreases inflammation in the joint more than the CC loop or the PEMF devices. And positioning is extremely important. So your rehab person can do laser at the clinic, but doing it at home can make a huge difference.
Okay.
At our website, optimumpetvitality.com, we have a pet parent laser course that teaches how to do all the joints. I would highly recommend it. And if you purchase the course and you decide you want to buy a laser from either Respond or SpectraVet, by being in the course, it gives you 10% off of the laser, which way more than pays for the course. So just thought process there. The other thing I'll say about it is once you have a laser, use it for everything, every dog, right?
Mhm.
You use
Yeah.
ears, mouth, joints, everything, skin.
Okay.
Very,
Thank
very
you
good.
for that.
That was not a shameless plug at all. That was very good.
I was trying to help her. I mean, I see, you know, people say, oh, I lasered it. And I watch them just go over the joint like this, right?
Yeah.
And like the position of the probe and the position of the limb is so important to get mediocre results versus amazing results, right? I just want people to learn.
Yeah, no, that's very good. Okay. Question, what's the best supplement for old age dogs?
The one that has the most research behind it is having a good omega-3 fatty acid, right? So weight control is super important, your omega-3s, and I'll be honest, I usually recommend rotating them. So whether it be Standard Process has a good one, Thorne has a good one, Dr. Busby has a good mobility one. Nordic Naturals is really good. Omega, what is it, 3D, has a really good one. And then just rotating through, not like each day, but a bottle of this and then a bottle of that. That's that. And then pernamuscles. So there was Leilani Alvarez did an amazing job reviewing a meta-analysis. And again, I'm a research nerd. I'm cool with that. And looked at, everyone says glucosamine chondroitin works. No, it doesn't. And what they found was that the products that had them isolated did not have the best results. So when you see just glucosamine and chondroitin, and the products that had the whole animal that has all the coenzymes and everything else in it, the pernamuscles, those are the studies that had the really good results. So when you're looking for a product, you want to make sure it has pernamuscles, or you may see it as green lip mussels. And then there's, again, I recommend rotating through them because everything has different stuff in there, right? And collagen's huge too. There's Jope is a one. Now, if you're going to use Jope, they recommend using it at a different time. That's a collagen UC2. It doesn't affect the joints per se. It affects the gut to decrease the inflammation to help the joints. And if you're going to use that and a glucosamine chondroitin supplement, you just give them at different times of the day.
Okay. Good point. Okay. Okay, for everyone that's still here, most of us are still here. It's great. So obviously we're captivated some people. I put the link for your free webinar coming up, the Fascia Fun. And so definitely, if you want to get that, how do you spell Jope? That's a
J-O-P-E.
I thought it was that, but I didn't want to commit. Okay. Okay. Anything further you want to sum up with, Laurie?
Guys, if you want to go to our website, optimumpetvitality.com, we have a little link on top that says Learn and Goes. We have about 100 different free videos that you can watch. Everything from exercises to stretching to laser to all kinds of great stuff. I love teaching. If you have questions, you can feel free to email us at thrive@optimumpetvitality.com. Come to the webinar and let's have some fun. Let's learn and help dogs and cats.
And cats. But cats don't need it.
For Fascia, they get arthritis. They
We
absolutely
get arthritis, yeah. There's some. We had a cat that had he broke his cruciate and all the collateral ligaments in his knee.
Oh no.
He had a 4-hour specialist surgery, and then he was confined to I call it a chicken wire cage on the floor that was only that tall, for about 3 months. And the poor guy, giving him a wad of paper was, oh boy, it's fun. Like he was in trouble at that point. But yeah, when I think about it, his fascia would have been just messed up totally. Yeah.
I bet. Yeah, absolutely.
Yeah. Yep. And thank you, Stacy, for telling Connie the replay will be available. I've just got to get it edited, sent to Laurie. She's got to put it up. We've got all that stuff to do, but it will be done. So it'll take probably a couple of days, maybe to hopefully by Monday or so. Okay.
Well, and then are there supplements for cats? Absolutely. And again, if cats have issues, take your fingers, move their skin. If the skin is attached to their body wall, work on their fascia. Even just gentle massage will help.
Okay. Yep. It's a good point to check. Okay. Well, thank you very much for coming on board, Laurie.
It's always fun to chat with you, Jeff.
Okay, this has been great. And thank you for everyone for turning up. It's been great having Laurie here. And she's here. Laurie's heart is help the animals. Okay. And so the point is that she does everything from that perspective. And she's got some really good courses, which are both for veterinarians, professionals, and for you. And the thing is, you can learn some really good stuff and take better care of your kids. Okay. But make sure everyone gets to that free webinar. And hopefully I'll see you there.
It sounds great.
Okay.
Take care.
Okay. Bye-bye, everybody.